Hey everyone, what's up? This is Dr. Charlie, PT here. I wanted to create a video for you today to sort of help you lay some ground rules for if you're going to PT right now, and or really any treatment. This could be applied to any treatment that you're trying right now for some type of pain in the butt. Piriformis Syndrome, maybe it's an SI joint problem referring to that. There's lots of stuff that causes the pain in the butt. It could even be a back problem. Maybe you've been told you have a disc problem or something like that, and you also feel a pain in the butt and or the leg. Either way, you're probably trying some treatments, and a lot of the treatments, unfortunately, out there just don't work that well. All right, so specifically for you, if you're trying treatment, we'll call it physical therapy, but again, this can be applied to anything, and it's either A, not working, and or B, it's making you worse. And so I want to lay like maybe 3 or 4 ground rules, if you will, some things that if I were mentoring other PTs, and or if I was talking to someone like yourself who had some type of back, butt, and or leg pain, that I would be very cautious breaking. I would be careful not to break these rules, all right? And so the first one would be that you want to make sure that you're not doing yucky motions, all right? So only yummy motions. Now, there are maybe some rare cases where you need to push into pain. I never push through pain, but into pain. And if that's the case, right, then the pain should go away immediately once you finish the exercise. But either way, no yucky motions allowed, okay? For the vast majority of people, we're talking 95% of people that I work with will not respond to doing things that feel yucky over and over and over again. 3 sets of 10 reps, 30 times yucky, right? And so don't do yucky motions. Even if it hurts so good in the moment, it still hurts, all right? And so yummy motions must feel good for the body. Another way to state yummy would be safe. So maybe say no yucky threatening motions or no yucky unsafe motions. Only do yummy safe motions, safe to the brain. You want to start to break this movement pain relationship. When I move, it hurts. So you want to do safe things. All right, so that's the first ground rule. Second ground rule would be treat into ease, not restriction. All right? So many people treat into that which their body doesn't want to do. They have trouble getting into the figure 4, and they push it a little harder, right? They try to pull their knee up to their chest because it doesn't want to go, it doesn't want to go, right? But think about it. Like my daughter this morning, she tried untying her shoes. And when a couple things didn't work, she got a little frustrated. She got a little emotional. She tried pulling on the strings a little bit harder. And what happened is it made the knot even tighter. Maybe you've had like a necklace, right, that's gotten kind of all wound up. Those are the worst, right? Like the chains, right? And you start pulling on things, and if you're not careful, you're going to have trouble getting that undone, right? Now, when it comes to the body and using movement as medicine, as well as the mind as medicine, if you treat into restriction, you're going into a direction your body doesn't want to go, and you're pulling that knot tighter. You're increasing the threat within the system. And usually what happens is it recoils, right? Like if I had a band, or you know those TheraBands when you go to PT, and I pulled it, like the more I pull, the more it wants to rebound, the more it wants to recoil or kick back, almost like a gun, okay? And so the more you try to force that what your body doesn't want to do, mentally and physically, it usually kicks back, all right? So just something to think about there, all right? So, for example, if your body doesn't want to bend forward for whatever reason or for whatever diagnosis you've been told you have, maybe a disc problem or something, my body doesn't want to forward because the disc and the jelly is going to come out the back. No, it's not, all right? But either way, let's just say your body doesn't want to move forward. Well, maybe you bend backwards, or maybe it doesn't want to go forward to the right. Maybe you can go backwards to the left. If your body doesn't want to go backwards, maybe you can go forwards. If it doesn't want to go right, it could go left. If it doesn't want to go into lengthening of the figure 4, maybe it could shorten. If the right side of the body doesn't want to move, could the left side of the body want to move? If the lower body is completely off limits, could the upper body do what it needs to do? Right? And so this is what makes it difficult, is because lots of people reach out to me and they're like, Dr. Charlie, just tell me, the exercise to do? The truth is, there's lots of different options. But at the very end, you could simplify it to start with the rule of opposites. If your body doesn't want to go right, maybe it could go left. Righty, tighty, lefty, loosey. And a lot could be learned via that statement, right? If it doesn't want to lengthen, it might want to shorten. If it doesn't want to shorten, it might want to lengthen. And so we can use these base principles to start to test motions, test inputs, plug code into the system to find that which will work best for you. All right, but that's the second rule, okay? Instead of going into resistance, which a lot of PTs, providers, chiropractors, right? Your neck stiff to the right hand, try to fix and go into that which the body doesn't want to go into by pushing it further into it. I found that to not work very well. Go into ease, all right? Another kind of rule and or thing to think about, if you want to call it that, right? Third thing would be you can't manage what you don't measure. This is super important, right? Because if you've tried a sheet of exercises, most of which probably hurt so good, right? Then call it PT, call it chiropractic, call it whatever the treatment was you've tried. It's essentially like saying, hey Charlie, I can't figure out why my treatment doesn't work, but I just did a bunch of random things that hurt. And, well, it didn't work, right? So I did a random group of exercises that hurt to try to get out of pain, right? And that's why it doesn't work, okay? Because it's random, and you did a bunch of things that hurt, and you just multiply that over and over again. It's no wonder people are confused, right? And so you can't manage what you don't measure. So how can you measure what you're dealing with, right? Pain is subjective, absolutely. It's not the easiest thing to measure, but it can be measured, and or to some extent. Here's the cool thing, you can make it up. You can make up a measurement system. Maybe it's how far you walked today. And next week you can measure against that. Maybe it's how far you swam today, or how high you could jump, or how fast you could run. Maybe it's your cadence. Maybe you have one of those fancy watches, measures your cadence, your distance, or your heart rate, or whatever. The idea is that you want to measure movement quality, how your body is moving, and you can do this via self-assessment. This is what I teach people all around the world to do, is move their bodies in different ways, move their body in different ways, and assess how things feel, yucky, yummy, and to what extent. We can get a baseline, right? And they can sort of quantify how well you're doing things, sleeping, driving, sitting, whatever, and what that tolerance might look like. And in doing so, you can get a baseline, right? If you were gonna start on a weight loss journey, you would probably benefit from, I would hope, some type of scale and or body fat measurement, I don't know, system, right? Testing, there we go. Biometric testing, right? And so you want to measure so that you can manage what that data is telling you, right? And decide what to do and make decisions based off of logic and objectivity, not emotion. Because if you don't measure something, I had a guy reach out to me the other day and he's like, Dr. Charlie, I need help because I'm going to keep doing what I'm doing, but it's working very slowly. I'm like, what do you mean by slowly? He's like, I've been at this PT for, 6 weeks, 8 weeks, months. And I'm like, well, how are you measuring progress? How do you know it's getting better? He's like, well, I think it's getting better. I feel it's getting better. And I'm like, well, that's your problem. You think you're losing weight and you feel you're losing weight. Are you actually losing weight? He's like, huh. I'm like, yeah. So you can't manage what you don't measure. How do you separate the PT working from just natural history or time working for you? And he's like, well, I really can't. Well, that's not a good plan, if you ask me. All right. And so we've got to be able to measure this stuff, people. All right. So establish a baseline. You can't manage what you don't measure. You've got to have a way of measuring your movement quality and measuring your functional ability and being able to, not day to day, but week to week, saying, am I going in the right direction or not? And then you can look at those trends to make decisions around what you should do. Should you keep doing what you're doing? Should you tweak it or change it? Or should you stop it? Right? That's sort of the third rule. Most PTs, most providers, they do not measure what they're doing. And so they give you a bunch of different things. This leads into the fourth sort of rule, if you will, something to think about. And no wonder things don't work, because they throw a bunch of stuff at you, they don't measure it, and they don't know if it's working or not. Instead, they take shotgun approach and hope that it works. That's called hoping and praying. And while it works for a lot of things, right, not sure that's the approach I would take if you're trying to be really scientific about solving this problem. All right, now, kind of fourth and final thing is that you want to focus on the one thing. Now, what is that one thing? You want to focus on addressing one theory or hypothesis at a time. So if you've gone to PT, here's usually what happens. Or again, any treatment. It's universal. You've got a weak core, we'll do some stuff there. You've got weak glutes, we'll do some stuff there. You have tight hamstrings, so we'll do some stretches there. Your nerve needs to be flossed, so we'll do some stuff there. Your pelvis is out of alignment, so we'll do some stuff there. Your one leg's longer than the other, right? And you've got all this stuff. And so you end up doing 3, 5, 7, 9, 11, 13, right? 2, 4, 6, 8, right? You end up doing a bunch of different things. And just because you can do something doesn't mean that you should do something. And again, it's a very unscientific way to run an experiment. You're essentially running, if you're addressing a weak core and you're addressing a weak glutes, and then you're stretching the glutes because they're tight as well, and then you're stretching the hamstrings, right? Like 4 different things that are independent theories, but you're grouping them together and you're doing them all at once. And it's no wonder why you can't figure out what's going on. And it clearly shows you that whoever you're working with, who's addressing those things, this is just my opinion. Let me know in the comments if you have a good argument to this. I'd love to hear it. I'm open to hearing it, right? Because I definitely don't know everything, but it just doesn't make a whole lot of logical sense. This is a clear indication of whoever you're working with, who designed that program to try to help you get out of pain, has no clue what they're doing. Because there's no unifying theory there. They're treating many different theories at once. All right? I'm cool with theories and I'm cool with hypotheses, but at least address these things scientifically. And so that's that, okay? So if you're going to PT or you're getting treatment for the pain in your butt, whether it be due to Piriformis Syndrome or an SI joint problem or bursitis or herniated disc, if you want to know or you want to figure out the most likely source of your symptoms, feel free, if you haven't already, check out my DIY diagnostic guide. But otherwise, if it's not working, A, or B, it's making it worse, it's probably because you're breaking or they're breaking. Here's the thing, not really your fault. Right? This isn't probably what you do, and that's why you're here trying to get some help. And so at the end of the day, they're probably breaking or you're inadvertently, unintentionally breaking one of these sort of 4 ground rules. Number 1, you're probably doing yucky motions. Only do yummy, safe motions. All right, good for the body, good for the brain. Number 2, you might want to consider not just going into resistance. Don't treat into resistance, treat into ease. Find out what your body doesn't want to do and give it what it does want to do, which is usually the opposite as a start, okay? The third thing, you can't manage what you do not measure. Really hard to tell if you're losing weight. Really hard to think or feel if you're losing weight. If you're just being subjective and emotional about it. Really hard to determine if what you're doing is working if you don't have a scale by which you can measure progress for same, better, or worse. You've got to objectify, put some numbers to, put some quantity to. You've got to quantify the pain experience with regards to the way that you move and your function, the way you sleep, the way you walk, the things that you really want to get back to, right? And then we want to have a system for tracking whether or not we're going in the right direction or not. And then we make decisions based off that logic and data versus just emotion. All right, so that's the third thing. And the final thing is the one thing, right? Instead of doing everything. So maybe the ground rule is like, I don't even know what the rule would be, right? I think you get it though, right? Less is more, all right? Most people think that more is better, all right? But less is more. Focus on the one thing. One theory at a time, folks, okay? So instead of addressing core weakness and hamstring tightness and hip tightness or whatever, right? You're right. It is a bit theoretical. This stuff is not easy to always figure out, but you've got to start testing somewhere, all right? And so we don't address all these theories all at once. Now, there are lots of different theories. There's 118 motions you could possibly do to solve this. That's what I've found in my sort of discovery of traveling all around the world and working with people. I boiled it down to 118 options. That's just motion, right? There are other things within that. How you move, the way you sit, the way you don't sit, the way you lift, the way you bend, the way you do, the way you sleep, the way you do everything. That's, there's other theories involved there. There's also kind of this mindset and or perspective shift a lot of times that needs to occur. So we've got the brain, and there's theories within that could cause pain. Right? So there's a lot of different theories. So you can absolutely try to DIY it if you want, but just recognize there has to usually be a system to kind of hammer down that one theory to begin testing with, or to begin testing, right? That's going to give you the biggest bang for your buck. So instead of starting with all these options, 120, 130, gosh, probably infinite possibilities and or hypotheses or theories about why you could hurt, you can hammer down maybe the top 3 or the top 5 and start there, okay? So that's the power of a system. That's how you get there, and that's how you narrow things down. And those are some ground rules if you're trying stuff and it's just not working or you feel stuck, okay? So let me know your thoughts below. Was this helpful? Was it not? Let me know if you have any questions. You guys inspire a lot of my content. This came actually from someone who reached out to me, like I said, and was like, PT is not working. Some people say go to PT. Other people say don't. PT is just motion, right? And there are some rules that you should follow, in my experience, when using motion and or using natural treatment to solve these problems. And these were just 4 that just popped into my brain right now on this beautiful day. Okay, so let me know your thoughts below. Let me know if you have any questions. Hit the like button as well as the subscribe button and the bell for notifications when we go live every single week with new stuff. Thanks so much, everyone. Chat soon.